He's out of danger now. Now, Ryle's tube is there, catheter is there, but he's talking and has started to take little bit of walk.
Chalo,
So,
good.
come out of the danger situation. What would have happened if I had not shifted him from this corporate
No,
hospital? No,
really, madam. Nowadays, no, it's very
because of
difficult to
money.
trust
See,
our own family.
once you have ruled out this brain hemorrhage is not there, what is the need? You should have called one medicine person because chest infection is there. And he was telling me that, ma'am, TLC count is normal and chest PAVU is showing, chest X-ray is showing normal. And when I shifted him to Bhubaneswar AIMS, they told me that because X-ray is a posterior PAVU, so infection is there in the posterior side of the chest, which is not showing in the X-ray. Those people did HRCT chest, and they suspected that it is brain encephalitis. Because of that only, he is not able to respond anything. He was constantly put on oxygen mask. So you see how misdiagnosis can
Madam,
let it.
corporate people, they are doing everything
Very
on
difficult.
Yeah,
teleconsultation.
and
Yes,
see, I
and
told
until you
him
have
that.
someone in the medical field who is very close,
Nahi,
then only.
no. Even and that corporate hospital, no, I am working in that institution only, and that corporate hospital is part of that university, you know. I
Mm-hmm.
told him that my father is a general surgeon. Matlab, he himself is a surgeon. Being his daughter, I am also a doctor. Hmm.
Correct.
So still then they are behind money and this insurance. Anyhow, they will make a bill of 1.5 to, they made a bill of 1.29. You know. So when I discharged him against medical advice, they told me that okay, we have to do nothing. Whatever we have done in our part, we have completed that. We are not able to diagnose where the infection is coming. So I told him that, say, please don't mind. I have to shift him. I hope you won't mind. So he told me that no, we won't mind. You take him.
At least they release it in that is important. Sometimes even that too they.
So this is how you face life. What to do? My being a doctor, they told me that, see, if you have told us to call the pulmonary person, we have called him. You told me to call the medical person, we have called him. Why I should I tell you? You should call
Correct.
them. Hmm? At least in the AIMS, they did the perfect diagnosis and he came out of the danger. So
And is
what to
on
say?
conscious also. That is important. Once conscious is regained, now everything will be fine.
Yeah. It was actually a near-death situation, you know. Total. That was a miracle that I uh, changed the hospital and
Correct.
came out of it. So I was unable to attend the class last time, no? Because of this hospital and all those things.
Yes, not a problem.
Hmm. I also randomly choose the topic because ma'am will get angry. So I have not done any literature search and all those things.
Correct.
Let's see.
Madam,
Even
madam,
we're also not
madam,
that prepared today. So just madam told no, at least you come prepared with the
Yeah.
topic of your
See,
interest.
whenever
That's all.
I'm searching, na, whenever I'm searching the topic in the net, I don't know.
Hello?
I'm.
Hello?
Yes,
Hello?
good evening. Yeah.
Hello?
Hello,
Hello,
good evening, madam.
Hello.
good
Yes,
evening,
ma'am.
madam.
Yeah. So, what I'm telling you is
Madam.
start discussing the topics with each other.
Yes,
Okay?
ma'am.
And
Yes, ma'am.
if Mirna, don't worry, you tell me one or two topics, I will help you out in a day or two. You tell me.
Ma'am, I have already written two topics. I'll be telling those
Uh,
topics
uh,
only.
I am logging out because I can't hear anybody.
Okay, ma'am.
Okay, madam.
I'm not getting a material. Once I get the composition material, not today. We can start it. Let's do the composition. Then, mostly on Friday. Friday.
Could anyone
Sir.
come Sir, good evening, Narendra sir, Anand sir.
Good evening, everyone. Good evening.
Good evening, sir.
So who will win the cat?
From somewhere, sound is coming, no?
That person who has hosted the event,
Okay.
that Bhavnagar, that person. Yeah, now he is muted. It's nice to see all of you together. Can everybody on their videos? Yeah, I will take one snap.
Sorry, madam. In my laptop, there is no
Who is
webcam, madam.
smiling?
Yeah. Siddharth sir, you cannot open my video.
Madam, my laptop, there is no webcam, madam. That's a problem for me. This Asus ROG series, it is not giving a webcam. I don't know. They took 1,20,000 for the laptop, but they didn't give a webcam.
Oh,
For ExoCAD and all, I took it, and I didn't check it also.
You log in through
Just
your
realized that
mobile also.
even if I log in, sir, the problem is I have to do my concept mapping and all during. I have to say to madam.
No, you present through your laptop, but
Yes, sir.
video you can mute one of the devices.
Okay, okay, sir. Okay, sir. Okay, sir.
I've picked 2-3 snaps. I'll just share with you guys.
Dr. Meenakshi, what we are going
Yes,
to do today?
Sir, we shall discuss, sir, our topics. We will exchange ideas. Please guide me also. If I know something about your topic, maybe I will be able to share some details with you.
Basically, everybody has to be present. The
Yes, sir.
topic.
Yes, ma'am.
Madam, whatever topic we are trying to take it at, because any topic we have to do it at institution level only. What madam is saying.
Yes.
What problem I was facing with the topic is like how far the background support will be available for us at the institution level.
No, that you have to motivate your principal, your institute.
Exactly. I have already started working on kind of a pilot thing I'm doing. I was just waiting, like, let's see what others are doing. So we had a concept mapping with the person who is there in ethical clearance and all.
Okay.
But the thing is, how far it is going to be successful or not? Like in this particular thing, when they taught us to have the outcome part, like the short term, intermediate, long term. For that particular part, whatever topic is coming into my mind, it is becoming like whether we can go ahead at institution level or not. That is what is coming into my mind.
Dr. Siddharth, with everybody.
That is the difficulty I'm thinking, because so many hierarchies are there, so many seniors are there.
No, that's okay.
So
at your department
not
level, you
audible.
try to. So from your department
Hello?
level, you first initiate.
Hello.
With their confidence. From the department level, you try to initiate.
One second, madam. It's not audible.
Okay.
1 second.
Please guide me. I am choosing a topic called Students' Perception in Introducing Simulators in the First Year MDS.
Good, sir.
Simulator means for tooth preparation?
Yes, ma'am. Preparation simulators and the simulators, we saw it in the PG convention in Hyderabad last time. There was a
Dr.
PG
Arun,
as well.
what I want to
Would
tell
you? Yes, ma'am.
you must have this simulator in your where you are working now. Simulator must be available to students.
We are in the process of purchasing, ma'am. We almost in the completion of that. So their perception of using it, is it worthwhile, or using the previously used the models or the mannequins that we use?
Then you can take it.
We had a workshop, but we have not purchased exactly into the unit, but the students have undergone some amount of training.
Pardon me, sir.
Sir?
Sir, would you repeat the topic, sir? Arun, sir, once again.
Students' perception in introducing simulators in the first year MDS.
Okay.
Any alternative, sir? If at all, if you are not unable to purchase the simulators.
It's almost in the way through, ma'am. One more thing is need analysis to shorten preclinical exercise in the first year MDS.
To shorten.
Basically, we spend 6 months in the preclinical exercises in the MDS first year, which is not relevant for a person who's already graduated. So he's doing the same thing which is done on the patient. Again, he'll be coming back to the zero thing. So I need analysis to shorten preclinical exercise in first year MDS. Is it a norm because for me everything is being gone by our defense services, but in your colleges, do you recommend 6 months of preclinical exercises or it is straight away onto the patients?
No. 6.
As far
Again,
as
it get extended
curriculum
to
is concerned,
7-8 months.
Yes.
as far as curriculum is concerned, sir, you will not find any guideline printed that 6 months is mandatory. It's not like
They actually usually take more than 7-8 months to finish it.
it's a span of 1 year.
What is a necessity for already a doctor who knows how to handle the patient? So for him to go through this, starting from his model till the class 2, class 3, class 2, class 3s are still okay, but going through that preclinical exercise again would be wasting of time rather than exposing them to the more of.
What we have learned in the undergraduate, it's a crude one. We just want to make it entire person, defined one.
What is the topic you're discussing? What is the topic?
Ma'am, I was proposing need an analysis to shorten preclinical exercises in first year MDS.
Okay. So when you say Arun need analysis, what need are all stakeholders, right? Stakeholders are students, stakeholders are teachers, stakeholders are also the learning objective what you have for BDS. Like ultimately, so when you can reduce the exercises provided they are still able to learn all the skills.
Ma'am,
So
this is for the
first you need to
MDS students, ma'am, first year MDS.
first year MDs. Okay. Okay. That is excellent because we need to reduce it and we need to make it like, month and a half and not more than. I had made that in my college. Not more than 6 weeks. And those who are maybe little slow. And secondly, this is only an introduction to them that you are a postgraduate. So you need to know about, supposing they need to go to the operative, restorative department because post and core needs to be done. Periodontia department, they need to connect, that's all. Oral surgery department, also to radiology. So these are rounds of 7 days to learn something, post and core. They should know about it, how these things are done and how they know how it's done, but have reference. So maybe 3 days, maybe 1 week, and then certain exercises already they have done. Why to repeat? Instead of that, we can introduce them to the materials, the newer materials, and how to select these newer materials. It should be ongoing process. I think this all of you can put in, and we can publish a paper together. Because there has to be a joint paper by all of us. Arun's topic is excellent. Arun, there
Yes,
are so many aspects.
One more proposal, ma'am. Students' perception in introducing simulators in the first year MDS.
Okay, so come out with it. Exactly what do you mean by simulators? Dental simulators are just not those type of simulators what they use for laparoscopic operations and all. Literally operations are done by everything. So simulator, exactly what do you mean?
Ma'am, during our Hyderabad PG convention, there was a PCC wherein our preparations, all our preparations, or to an extent the tooth preparations, inlay preparations, anything that we do, how much of pressure that we are going to apply. Those gives us exactly what we are going to do it on a clinical basis. So this is a machine which can be utilized.
That will be expensive. Is it indigenized?
No, ma'am, it's being purchased by the institute, given to the students, which.
No, you cannot measure the pressure. See, the Savita Dental College, no, they have a lab. They have many labs. In that one lab is all these things. I saw that online during the COVID time. So they showed me online. It's such a high funda machine. It's very good. But how many colleges are ready to invest in that? Because there are so many other things priority.
It's like when the pilots generally keep going to their simulators before going to the exactly, because what we have to do is
Either India may think local, act global. But sorry, think global, act local. I'm sorry. Act local. So in India, what is the necessity? One patient told me when I was in the college, he told me that ये लोग सब सीख रहा है, ये तो हमारे ऊपर भी सीख रहा है. He knew that, and I'll tell you, our patients are so accommodative. Abroad, the patients are, and something clinical dexterity of the pressure. You know, some pressure cannot be measured even by those instruments. It can be, they only give you the output. What is the pressure Arun applied? What is the pressure Mirna applied? What is it that Sandhya is applying? That's all it can give. It cannot tell you how much to give unless, because every tooth structure is different. So what you are teaching the students is that technical dexterity, the finger ka jo hai wo aapka mind, how it is connected and how you feel that. You can take a mirror and just open like this left, right and cause pain. If you are gentle, patients, I would not allow anybody to just rough handle me in the mouth when it is painful. Some areas are painful. If you just put a mirror and a probe and something. So yeah, your idea is good. But think if you can do this machine, you can discover this with your department of technology, one of the colleges, it's great. लेकिन आप क्यों करोगे? See, last year one girl, I'll tell her name. She's Shamim. What she did was she wanted to teach the students online with a software app articulators. But what we could reach is only turning the articulator left, right, upper, niche. Okay for second year student. I told her, you want to go ahead, you go ahead more deeply. The movements. And don't replicate if some foreigner has done. Research is not to sit under a tree and say, now apple will fall. Newton's law, I proved. No, Newton has proved it. Now you go ahead with it. Educational research is called educational project. Are you all with me?
Yes,
Yes.
Why it's called a project? You're going to apply it in your college. So when you're going to apply it, the secret is, ये अरुण का प्रोजेक्ट है, ये संध्या का है, ये पडियार का है, सब होगा. But if you include them and take a focus group, or you ask them, is there need? What should we do? Your ideas are important. And it's not only HODs across the cadre. Then they will say it's our project. The whole secret of success for any administrator or anybody who is in position of leadership, even self-leadership, is to have inclusiveness. If you don't include, you are ordering. If I ask my son that, can we do this during the Diwali? I think we should do this. And what is your idea? He'll say, no, mom, you can't do the puja in the morning. You do in the afternoon. I am not there. Or I'm not there in the evening. It becomes inclusive. Then he's supposed to be there. If I say, I am doing it in the evening, I'm not there. वो तो एकदम crude example हो गया. Then I'll say, you have to be there. What do you mean by that? So there is a discord. This discord is there in the college because everybody feels the HODs are deans and just ordering. And to tell you the truth, I started this course more for academic leadership, because what I have gained is how to deal with people. We are all people. We are not doing people-centric giri. What we are doing is, I am here and this ought to be done. This is good for the college. Okay, who said it is good for the college? You are saying, we are not saying, man. So your idea is good. But if you are going to get a machine of some 10, 15, 20, 50 lakhs. Not good for India. No college will buy. No
Madam,
college.
that person from Russia, madam, he was basically a surgeon. We saw that in Hyderabad. What his point was, it is more of preclinical, like those tactile sensations and all. He was saying that once you do that thing, once you get used to that thing, so once you touch a patient, your muscle memory will get used to it. He was trying to make that point.
So
Even
for
we
your
met him.
project, will you get to work on that machine?
Sir is from, I guess, central government. They will get, I guess. Arun sir.
Yes,
Arun sir,
ma'am.
I guess.
We had a workshop, ma'am. We are proposing to buy it. So in case if we get it, that is one of my proposal to do that one.
There is no harm in trying at all. It's a great start. Great start.
Madam, actually, if I remember right, the Dental Council of India has sent to all colleges a few months back regarding the simulators, and they have told colleges may try to install one or two. It is not mandatory, but I'm sure in due course of time they're going to make it mandatory.
But see, now whatever Dental Council has done, whether NDC will continue or not, we don't know. We don't know. NDC thought process may be different, and it is good to have simulators, no doubt about it. But I am asking you the economics, because you are a dean yourself. If you tell your management, I want to buy this, but what is your priority to see that all the chairs, units are working properly, the machineries are proper. In the surgical scenario, everything is in order. Patient need not be cancelled and sent away. The implant surgery, physio is not working. So please prioritize things. And Arun can afford to do it. Army has money. Whether you can. My idea is Arun should do it. And now Arun should try and make one indigenized so that it can be patented for India. और मैं तो बोलती हूँ मेडिकल डेंटल में तो पेटेंट नहीं करना मांगता है because people the infringing on our intellectual property, infringing on it, वो नहीं होना मांगता है. Otherwise, if you have a wonder drug and you patent it, 10 years people are not using the some cancer immunotherapy drug, and later on, when 10 years later patency goes away, people start using. What is it? 10 years people have died. And all this immunotherapy also is a big farce. It is affecting the liver. Because recently I know, what I'm telling you is, think of invention, think of discovery, think of outside the box, but think also of humans, think also of scenario. I said act locally. I will say think locally. It's a very good thing for an entry student. आपको किसने बताया कि कैसा posterior palatal seal में कितना pressure लगाना मांगता है? Seal कभी आएगा? We only taught you only observe the hand of the demonstrator and you learned. And some of the demonstrator faulted, you also faulted. So there is a use of all this machine. I am not saying no. But more than that, did you know the anatomy? Did you know what is R-line? Did you know the class 1, class 2, class 3 palate? I'm not interested. I'm interested in how the soft palate and hard palate, those muscles are, whether they curve gently, whether they curve steeply. Then I will say it's class 2 or class 3. But it's curving gently. See, think about the whole thing. Your projects will grow excellent. People are last year done excellent projects and they're trying to publish. But many a times what happens is, you publish in a wrong journal, they will not take it. Why would JIPS take all educational journal, this thing? And why are we loyal to JIPS for educational project? You understand? There are so many journals which will be interested in your project, which are educational journals. You want to be seen, there will be, I'm thinking that how, see, this is now inclusive innovation we can do. We can think of whether we can really start a journal in dental education, whether the dental education, see the conferences are so many now, people are tired of attending conferences. That from tomorrow there is a conference in just next door to me, Somaya in education. I am not attending because 24th to 27th, it's my celebrations for Guruji's birthday. So I have prioritized. I went all the way to Dehradun last year. Next year, wherever it is, I will go. I go every year. But the priority is different this year. So you think of your college priority, you think of, see, I'm making you think I'm running from this here to here. But from A to I'm going to Z without going to B and C. Why? I want you to think from all directions. Aapko, I think I will take 1 or 2 extra sessions and take academic leadership. I did that last year. I did that last year with Dr. Chari because, and myself, because we feel if you don't know what am I, my personality, then I will not be able to completely leverage my personality to become strong. And most important thing is we have to forget I in education, which we are not able to. We are all humans. We are all humans. They will not listen to us. We also don't listen to others. Abhi Meenakshi will go and tell about dietary counseling. They will say, kya topic hai? Aisa bhi koi bolega. And somebody will say, really interesting topic. But if she does a focus group with the friends, they will all take it up as their project. You have to talk to the head of the department, talk to the dean, but you talk to your colleagues. And we call it as 2-minute elevator talk. What is a 2-minute elevator talk is you enter the lift and instead of saying, which movie did you see? I think Diwali was great. I ate so many sweets. I have put on weight. Something like that you can talk. Or you can talk, hi, how do you do Arun today? How do you do Shilpa today? And I can say, Shilpa, do you know I'm doing this, thinking of this project. What is your opinion? And if the dean is there, I'll say, sir, can I have a word with you? Because I'm thinking of doing this project. I want to come and meet you. And when you talk to others who are not concerned with other departments, it is like propagating. I call it as propagating the idea. BJP is, I'm not against any party or for any party, but BJP is propagating, no? Propagating there, what they are doing this bullet train, they are doing that, they are propagating it. और तुम क्या propagate करते हो? हम लोग सब इतने छोटे-छोटे रहते हैं अपने में. कितना अच्छा काम करती है मिरना, but Mirna won't show it off. Show it so that people follow. People are like-minded. तुम कुछ भी कर लो, people's mind is a monkey. I used to be very inclusive as a dean, but there are a lot of people who took it for granted, so I had to become stern. And there are some people who don't like the way you talk. Some people like the talk. Students are also different. Faculty is also different. And some people are always finding fault. You know, they'll scratch sandpaper unke haath mein. And let me tell you today one secret. All people like-minded join together. And it is a fact because I don't want to make you read too many books, but way back in the 60s and 50s, one Swami Shivananda had said that thoughts also are waves. You believe in magnetic rays of the mobile, but you won't believe the rays. I am also many times doubting and all, but at the same time, thought process, Reiki, they give Reiki. So if you think positive, your positive hormones also and positive thought vibrations to others. When I'm talking to you, you get the enthusiasm from me because I am emoting it. तो मेरा thought process तो आपको जा रहा है और जो एकदम ही ऐसा gussa wala or thinking negative about you, you get the vibes. So in the college, कौन करेगा ये काम? Dean is supposed to be lonely. HOD is supposed to, you're lonely at the top. But you have your own company. There are two people in you, a big self and a small self. A big self tells you, it's okay, forgive them. So small self tells you, abhi barabar bata usko. You do understand Hindi or I should talk only in English?
No,
You show him properly. You show him properly. And we don't like, our emotional intelligence is very low. So we have to work on emotional intelligence also. A teacher's emotional intelligence is such, if it is high, he will be or she will be able to be inclusive to all students in the class. One student is mischievous. We say, isko batate ho. Dusra koi, or maybe somebody asks you out of nothing and you think that he's fooling you or he's trying to tease you and you had a bad day at home during the breakfast and you will say, shut up, sit down. He feels very bad because he's a 19, 20-year-old and for them, low emotional intelligence. In our country, there are 2-3 things we don't do. Is we teach moral science. Wow, moral science, we have to be Swami Vivekananda. Okay. But to be that, your emotional intelligence should be good. Be Anand. Where is Anand? Anand is gone. Okay, Anand. Anand.
Yes, madam. I'm there, madam.
To beach come. Where do you go? In between?
No, no, I'm there, madam. I'm there online. I'm listening to you.
Don't practice during the session, huh?
No, no, madam. Not at all.
See, now I am free with you because I know you now.
Yes, yes.
So now you will get my shoutings also, my love also, both.
Yes, yes, sure, madam.
I'm free for that.
Yes, yes.
I was also scared of you. You were also scared of me.
Yes,
You are free with me. You can tell me anything.
yes, yes. Not a
So
problem.
today, what I'm telling you is, basically, emotional intelligence can be, I don't take the topic because I'm saying you should be wanting to do it. So think of topics which are like, I want to read some topics for you. Last year I came out with this book. Like, can I pin myself? Can you see this? What is it written?
Let me see it.
Educational innovation projects.
So can you see the topics? See, the projects have been, I have given a forward. I will just read it. I'll click a picture and send it to you. These projects have been conducted in various domains: teaching, learning, curriculum, design, student assessment, program evaluation, and educational leadership. These projects have been conducted by CCHPE course students, and educational research is different from clinical research. The context for every innovation, the educational research is called innovation. Why? Because we are dealing with humans. Many a times the ethics committee asks you, students are vulnerable. We will not give you permission. One person didn't get last year, but he got ultimately. I told you that story. I told him, ask the dean, sir, you only give me an idea now. You all must be knowing him. He's from Karnataka. So I'll give you the name also. I mean, you can talk once. Once can I call everybody from last year so that they can talk to you?
Yes, ma'am.
Yeah, I want them to talk to you. Okay. So as academic leaders, the faculty members, the participant, first leaderships should know the leadership style, their negotiation skills. When you're small, you used to tell, Amma, I want that only. Please, Amma, you told me, you promised me, give me for my birthday. Maybe a toy train. Here you cannot tell the other people, this project is good. please let me do it, sir, please let me. No, you are going to have the negotiation skills. This has been very helpful in a college in the north, south, or maybe out of India. And don't give too many out of India examples. And also, you can negotiate by saying, can you give me some idea? They will give an idea. Everybody wants to advise. Nobody wants to take advice. Children are the best because they never take any advice. They don't give any advice. Okay? So they are the best. And we mothers never leave advising even if they are married. But sometimes you control because you learn. Because entire education is now directed by educational psychologists, not by only academicians. Every college has, because today we will just discuss about self-directed learning, and you will come to know. I'll discuss about TBL also with you, team-based learning. Let me see what is your idea. And I also want to do a lot of self-directed learning with you. Self-directed learning ऐसा नहीं होता है कि ये टॉपिक मैं नहीं ले रहा हूं तुम जाके पढ़ो, ऐसा नहीं है. You have to analyze the need. What is the area you want to, now somebody wants to do in diet, then how to go about with this? Your project is the best example of self-directed learning. How to go about with this? Am I ready to do it? Am I ready to learn? I am not becoming a nutritionist, but at the same time, I want my denture patients to not have deficiencies. So can I give them a good counseling with the help of a dietary counselor? I cannot tell him to maybe below greens low. I cannot tell a heart patient that to have those major greens. They are very high K2 and he's on a blood thinner. At least I should know these things. So the whole game now starts of you learning. Everything you will learn only through project now. See, this is a hands-on course. This is not a theoretical course. अभी आप चालू करोगे ना, so you'll come to know people skills, negotiation skills, your leadership. Otherwise, those people will say, what project is, what research is doing, you know, and they'll laugh at you also because you are doing some course. They'll laugh at you also. But the same people respect you heart of hearts when you have been firm and when you are shown the result. You got my point? At the end of the year, I want you to start a dental education technology cell in your colleges. We will start with the first lecture or the first session as to, first of all, the faculty should know what is DET. आप खाली board लगा दोगे, वो NAC को होता है. This is not NAC. This is actual practical. So आपको DET के लिए सब faculty members को, we will 2-3 of us will take a session as to what is DET, why DET is required, why a teacher should be a learner throughout the life, why the educational technology should be given. I mean, when the online learning started, many teachers felt students are not learning only. They are just closing the video and they are doing something else. The thing is that students want to learn if it is interested. My son told me once, see, my perception was in IIT all teachers are great, but it's not so. He told me, Mom, there are all types of teachers everywhere. So some teachers we on our own go, some teacher force us to come, and some teachers we know just for attendance we will sit and do something. This is the analysis of a young boy who has joined. I mean, now he's already passed and he's in US. But question is, that time I realized, I say, student hamare se bahut smart hai. And we have also done that directly, indirectly. So what's your take from today? I want you to think about your project in a global perspective. From all directions, what I mean to say is, just not that I want to have this test done. How would you get the people on board? You cannot test it alone. You have to have other people who are going to do the work for you. Last year, when one of the persons did about prosthodontic direct observation of procedures, I don't know, she did mini clinical test or something she did. So when the mini clinical procedures and tests were done, she wanted 2 other teachers to do with her the testing because hers will be biased. So first they had to teach them what is this mini clinical examination. Then we have to tell them how the checklist is made. So lots of things were there. And first, why we should do. Then the students, the PG students were given the know-how. Then they were asked whether it is good. Students felt very good because somebody just gives you a mark out of 100 for a preparation and out of 160. How did you give 100 by 60 by? Checklist is instrumentation 10 marks. The patient position 5 marks or 10 marks. Then tooth preparation, margins 10 marks. Line angles, point angles 10 each. Like that, marks are divided in the checklist. Would you like to do that? Such things which are good for the college. And they're following it. The best part is, if you are good enough, then people will follow it. And it's high time. Don't wait for the dean to start educational change in your institution. You need to be the change agent. Change agent.
Ma'am, can I say my topic?
Yes.
I have proposed 2 topics. First one is developing an institutional module of implant dentistry for the undergraduate curriculum.
Very good topic. But now a lot of intricacies have to be worked out.
Yes, ma'am. Ma'am, can you suggest me to make it little bit more pinpoint so that
you have to think of. There are lots of aspects. Sir, first of all, when it's an institutional perspective for implant,
yeah.
Can you come out with the topic again?
Developing an institutional module of implant dentistry for undergraduate curriculum.
Or the interns or something.
Yeah.
Madam, I guess, pardon me, madam, I guess your topic and my topic will be same, I guess then. I had posted in the group earlier.
Who is speaking? Who is speaking? Please make you pin yourself.
Madam, this is Siddharth here, madam.
हाँ तो सिद्धार्थ फोटो बता ना.
Madam, so webcam नहीं है इसमें laptop में, madam.
अच्छा ठीक है.
I had posted in the group this topic, madam, like implementation of
the same topic can be researched from 2 different perspectives.
Okay.
Yeah, madam. What?
No, I am not saying she should do the same thing, but I am saying that never think that the. See here, it's too vast a topic, Mirna.
Yeah.
First of all, is there a need? Need analysis करना है अपने को.
Okay.
All stakeholders' perspectives to be gathered.
Mm-hmm.
And when you introduce this module, like, last year, one topic was on the digital dentistry. I sent it to you.
Mm-hmm.
We did that with 3 or 4 stakeholders, initial need analysis, how to do it. And, that day somebody was talking about model. Okay. So how do we go back and forth with that model? So then she developed, because the topic was digital prosthodontics, it became narrow.
Mm-hmm. Mm-hmm.
Here, what aspect? You want to develop 5 modules for them, even the theory, then you want them to know about implants, the implant coated surfaces, the geometry and placement, surgery, prosthodontics. What do you want them to know?
Madam, what would be the research component of this topic?
Research component would be as they develop. See, Padiyar is asking the right question, Mirna. The research component would be there is no null hypothesis in educational research. She already wants to develop outcome. So now outcome है, तो आप कौन सा steps लेके वहां तक जाओगे? तो इनका टॉपिक इतना वाइड है तो ये स्टेप लेके नहीं जा सकती है, दौड़ना पड़ेगा. तो
Ma'am,
research,
I will make it more narrow.
how will I develop a module for undergraduates is the research question. How will I develop?
Pardon
How
me, madam.
can we develop?
Pardon me, madam. Madam, what I have done is I have divided this entire theoretical part into 4 different years, madam. I spoke to the surgery HOD. I spoke to the perio HOD, madam. Then we have devised a preclinical module for them. Just a preclinical module till final year. So, like, what feedback we got, like our principals, the respective HODs, we sat down. What we did is, like, we divided the parts. Like the surgical part will be taken by the surgery HOD sir will look into it. The perio part, the soft tissue part and all, they will look into it. The oral pathology people will teach them initially about bone, metabolism of bone, all those things they will take it. And the rehabilitation part, prosto people will take it. And being the implant in charge of the college, they will be posted under me, madam. Whenever they are posted in perio, surgery and prosto, 5 days they will come to implant department.
So now can I come in?
Yeah, madam.
Yeah. First of all, you always have time limit for this is a elective or this is a regular?
Regular, madam, regular.
So is it included in the Dental Council of India or NDC syllabus?
It is included, madam. 30 hours has been allocated for it.
So now it will be 30 hours. You have to manage in 30. One question is solved.
No, madam. That theoretical part is for 30 hours. There is no stipulated guideline regarding the preclinical part. I'll tell you, madam, how we landed on this topic. Like what we did is we called toppers from every batch, and I asked them what you want to learn next in dentistry. Like one of the interns said, sir, like every time they are asking us to pay 40,000, 50,000 for some course in implant and all. Even I was approached by one of the implant company, I don't want to name. They said, sir, you are in academics. I am a key mentor for them. Sir, you suggest your interns for this course. It was a zygoma course. The fees were 60,000. That time I felt when it is there in the curriculum, why can't we implement it? Why we have to charge the students something extra? So I thought, okay, this is the right opportunity wherein we can integrate that in their preclinical thing, clinical postings, so that it becomes a benchmark that they know the basics. If they want to learn something ahead of it, then they have to pay for it.
So rightfully you said basics. See, I can teach something in the middle school, say a biology, science, I am teaching plants, botany. I can teach them certain parts of the plant or maybe certain more aspects of it. But a high school student can be taught little more than that. And when botany, MD, MS or maybe PhD, he will do at a higher level. So when the students ask, the teachers ask, अगर BDS वाले को सब कुछ सिखाएगा तो MDS में क्या करेंगे? That is a very futile question. Because what you teach them is basic. Zygoma implant is not to be taught for BDS.
No, madam. It is just an example I gave. We are not teaching about
but zygoma implants can be just named and introduced. So what I will suggest to you is, how many hours in first year theory? You will only give about in physiology class, the bone physiology. The sigma cycle for a rabbit is how many weeks? And for a human is how many weeks? Can anybody answer this? You can Google it and see.
Okay, madam.
What is a sigma cycle? Is the entire osteoclastic activity giving rise to osteoblastic activity and the cell becoming, older and then completely again osteoclastic activity. The entire thing. But the osteoblastic activity, we want to see that it is continuous. Only if osteoclastic activity is there, the whole thing, why do we test it in a rabbit? Because rabbit sigma cycle is short. Human sigma cycle is much longer. Okay, 1 minute. So, bone physiology needs to be taught to the student. Bone physiology is very simple. But then what you will teach, you are not going to teach them first of all, ye implant hai. Then it will become very too much for the student to know. So what first and foremost, you can concentrate on preclinical aspects of implants. You can concentrate on the theory part. But if you want to develop the 5 modules, you should do this in 3 years. You cannot finish this project in 2-3 months or 4 months or 5 months.
No, madam. This in my concept mapping, I have divided into 4 years, madam. In 4 years, I have included all the topics, what has to be done. I'll send you a brief.
When you present it, we will see.
Okay.
Yeah.
Okay.
Just hold on 1 minute. प्रोग्राम करेंगे अच्छी डॉक्टर लंबो अच्छी शादी जो तो पण नाश्तो पण करू पहले थी ना डिसाइड करेंगे अच्छे लंबो हां उदा है here I am. So when you present it, do you want to present anybody? Or just come out with a topic quickly? So Mirna, what you have to think, whether you want to do the same thing with a different...
I have another topic. Either I will do a different aspect of that, or I have another standby topic, ma'am. Need analysis for adopting a multidisciplinary practice and training module for rehabilitation of the cleft lip and palate patients.
You want to restrict to cleft lip and palate only?
Ma'am, because I have known some plastic surgeons who are doing the case regularly, so I am keeping that topic.
Come again.
But I am actually more interested in implant. If Dr. Siddharth is doing that, I will find a different aspect to that. If I cannot narrow down on that topic, then I'll switch the topic.
No, but even if you do on the module making, nothing wrong.
So, ma'am, I'll switch to another aspect.
Multicentric it becomes.
Okay, yeah.
You heard of
yeah, do that. We can do that.
Yeah. See, when it is ideas coming from 2-3 people, it becomes more good.
Yeah.
Your colleagues all will give you ideas. Okay?
Okay, ma'am.
About it. Or maybe you can do one aspect, he can do another aspect, or if he's developing from the need analysis to the end, it's going to be difficult for him.
Actually, ma'am, I am more interested in the educational aspect of these dental students, but I'm not getting any topic. Whenever I'm typing educational research in internet,
it's very broad. It's very broad. What do you want to teach? How the teacher should teach?
No. I want to do some different methodology, and I want to check how is the performance improving.
Okay, now what is the research question?
Performance
improving is your outcome.
Yeah.
How performance will improve? In which subject?
In prosthodontics.
So you are doing on performance. In a Miller's pyramid, you are doing shows how. Do you know Miller's pyramid? I showed you.
Yes, ma'am, you showed.
Knows how? Does is the highest. So shows how you want to do performance. You do in performance, it will be great. Performance testing is done by mini clinical examination, direct observation of procedures. There are multiple tests that you can do in performance. And
actually, I'm more interested in that, but I'm not getting any topics. Whenever I'm typing in
PubMed, आप थोड़ा performance testing in medical education करके देखो और मेरे पास आओ.
Okay, ma'am. Okay.
Just text me tomorrow.
Performance testing in medical education.
Performance testing in medical education. Because you want to test the performance.
Yeah. I am actually more interested, but as I am not getting any suitable topic, I don't know what to type the terms.
You see, eyesight topic develop hota hai.
Okay,
And the
okay.
same way, your PG student should be told to develop a topic.
Okay.
वो जाके parent article, child article, grandchild article नहीं मांगता है. So, Padiyar, what is your topic?
Madam, it is developing a student support system for undergraduate students of a dental school.
Now, in student support system, what is the outcome you are testing?
Let me read it, madam. The rationale behind this intervention is the students joining dental school come from varied educational and social background. They face variety of challenges in coping up with a completely new professional program. So the dental school needs to offer a tailor-made, relevant student support system. So this is the rationale.
Support system cannot be. Support system can have a protocol. It cannot be tailor-made. I may be having difficulty in English. Somebody may be having difficulty in.
No, tailor-made in the sense, or maybe the word is wrong.
Yeah.
What I mean to say is
suitable.
Something, yeah, which suits our institution. Yeah. Or the students
develop a proper word. So in this support system, is it peer support you're looking at?
Student support
second year to third year, third year to second year first, something like that.
No, first year
or
to second.
Professional.
First year.
Newly
joined students.
From faculty and students.
Yes. The problem is the lack of a student support system in a dental school may put students at risk of poor performance and build-up of stress. Often the student performance comes to the notice of the faculty at later stages of formative assessment. So depriving the student of a chance to perform better from the beginning, and also the teacher from taking a corrective measures early on. So this idea came to me because in the recent orientation program for first BDS, I had invited somebody from clinical psychology, and I had asked them, can you just take a say 10-minute interview of each of our student, and do you have any methodology to find out something like problem students? That is, any student who might have some problems, or can we identify a student who can be a problem to us, something like that. So then this idea came to me as to, can we interview the students, because I was very much impressed with the qualitative research lecture last time, and I thought maybe we can go into some sort of qualitative research, taking into consideration students' perspectives, and through interview method, because this is something new to us. So I was a little excited to do something new also.
Yeah, it is a good topic. It's a very good topic. And the support system initially can come through a college counselor or maybe an external counselor, but later on you are making them do with each other so that there is a support. That is also very good. Ultimately, you will develop a sort of a coherence, ekdam harmony with the students, that they are able to spell out what is the problem. That's also very good. But you have to think about how you are going to achieve it. You have to read a lot of articles. And see, one more thing, my sincere request is, don't use problem student, problem teacher. They will create problem, because the word nowadays, even for, we don't use remedial class. We just, remedial class means, वो बुद्धू है इसके लिए वो आता है क्या? Students don't like mentoring, because wrong word. In India, we feel mentoring is for people who have some issues. No, we require mentoring all the time. Self-mentoring, talking to myself, mentoring with my husband, asking him, "Arey kya karu? I'm having a lot of stress in the institution. This person is." See, that person doesn't trouble you. It's my mind which says the person is troubling. There is also in education, we say, separate person from the work. Separate the student from his performance, in the sense that performance is done by him. But don't brand him as a problem or a low performing student. Always use positive words. Instead of saying a remedial class, we can always say it is a, sort of a repetitive class. It's a improvement class. It's a chance to scoring class. Something positive word.
Madam,
Positive word.
many terminologies come from our experience with NAC.
Yes. Yes.
Slow learners and advanced learners, and then so these see because of
To
this.
tell a student number 10, एक तो number से बुलाना ही नहीं है, क्योंकि number 10 is Kaidi number 10. So if you say some Kailash and you say that he is a slow learner, you are putting in his mind he's a slow learner.
Exactly, ma'am. And because
So
the NAC executives, they have advised, they have advised कि एक mentoring policy होना चाहिए. तो यूनिवर्सिटी ने एक mentoring policy ऐसा ही बना दिया. अभी mentors को पता नहीं कि करना क्या है. So what exactly they are supposed to do?
So we will do a mentoring class with you. We'll do a mentoring class with you. Last year we skipped it because of too many other topics I had taken. But this year I want to do mentoring. And mentoring, I'm not going to mentor you. I am going to,
No, as a dean, what I come to know is we try to offer solutions after the problem has come. So my this research idea is whether we can have some support system in place where we can prevent many things rather than student going into depression.
So think about it, develop, and next time you will be given 10 minutes each. Huh?
Right.
Yeah. So first 6 minutes presentation and then 4 minutes of question. Then only you are, or 5 minutes presentation, 5 minutes question is still better. Okay. So Anand, what's your topic?
Yes, madam. I thought of taking, madam. 2-3 topics are in mind, madam. Kindly guide me in that regard. So one is introducing elective course for the BDS undergraduate, a change in the curriculum. Introducing elective courses for BDS undergraduates, madam. The second one is basic research methodology for undergraduates in the curriculum.
The electives are very good.
Yes, ma'am.
Because electives gives an opportunity to do something what you like.
Yes, ma'am.
And
so how should I keep my topic name, madam, for this?
You look for educational research. What has been done in electives in medical education? You put the keyword electives and improving performance. What types of electives? You put it in medical education. Dental का बाद में डालना, dental में भी आएगा. Now a lot of dental journals have come up all over the world.
Okay.
And you just tell me what you want to develop, because if I give you some idea, you'll be stuck with it. I don't want to tell you that.
Yes.
Whether elective should be done is the first question.
Yes.
Your dean has to allow you to do electives.
Yes.
The university will say electives कौन करने बोला, और electives को अगर students don't respect what you don't inspect. If an implant module is done and you don't have any extra marks for that or anything, students will say ठीक है यार attend करो. Students after passing will say I want this, I want this, I want this. But when they're actually into it, they only want to score high and get into MDS. So we have one question, research question. How to make the students understand that learning is more important and performance automatically comes. My profession is more important. Money is a byproduct of my good work. But my idea is only money. I will compromise on my ethics. It's a very good topic. I think you chose an excellent topic. Shilpa?
Good evening, ma'am. Ma'am, my topic is assessment of knowledge and attitude of undergraduate students on importance of post-recall checkup after the completion of complete NCHEP processes. So most importantly, most commonly what we see in our day-to-day college, that the students will be very rushed to send the patient, complete the procedure and send the patients. But what they are missing is not to have that recall checkup. follow-up of those patients. So the how exactly the success rate, whether the treatment is success or failure
Link
or
it with the
any
educational
problems
research.
have been
This is
encountered.
becoming too prosthodontics. Link it with the educational aspect.
Ma'am, in this, I'm going to give the periodic flow chart where the patient has to do the follow-up. So it will be more of prosthodontic.
No, that's okay. You said about knowledge and attitude. But when you say attitude
Yes,
and
ma'am.
knowledge, pre-test, post-test comes.
Yes, ma'am.
And
Yes,
pre-test के बाद आप उसको educate करोगे, तो post-test का results क्या आएगा? Then you have to do
Yes,
a
ma'am.
longitudinal way, as you say, flow chart. Longitudinal way, whether it really improved in their second. See, this or all will take time. So think of doing before they come to the or may I don't know, because see, if you do to a new student before only, his will definitely understand the importance of how do the students know the recall is important? By showing him a case wherein the patients had multiple
Yes.
problems because the recall was not done properly. Again, a story comes.
Yes.
Think about it. How will you do it and how will you make it strongly educational? And you can do it. No problem. And what about Sandhya? Sandhya is out, I think.
No, ma'am, I'm here.
Ah.
Ma'am, I told you, I was planning on environment, educational environment.
No problem.
Initially, I discussed with you.
Yeah, no problem. Excellent topic. And now, who else is remaining? Rohit,
Jyoti.
Arun, Jyoti. Jyoti, bolo.
Ma'am, I'm thinking of involving the clinical dental material subject in either first year BDS or first year MDS.
Elaborate on that.
Clinical dental materials. Actually, we read about dental materials theoretically in first year BDS, and I think in first year MDS little bit. But in clinical dental materials, we'll be applying the knowledge, applied dental materials. Like we learned in pharmacology how to make a toothpaste, involving all the things. How to make a toothpaste, we learned. The same way, I just want to involve one more subject, which gives like clinical application of dental materials in first year. And if you feel that it involves more this thing, I can we can shift into even the final year BDS, third year BDS, or what all the years we can involve.
I think you
Applying
should
the
think
dental
about
material.
it more
It's
deeply.
like similar to applied dental material.
I know.
How do we assess that?
What is the outcome and what is the educational research in this?
This is a type of research where we use in alginate powder we use, ma'am, but we don't know how we make alginate. And we use cements, which is of different cements, GAC, composite. But we never know what is the composition of, we know theoretically what is the composition, but we don't know how to apply clinically, like manufacturing aspect. It might
be. This all become very subject oriented. This is not completely, you want to teach them. I don't understand as to what is your outcome you are looking at. The outcome is, can you elaborate?
Outcome is clinical knowledge of dental materials.
And that becomes a subject research.
Yeah, it's a subject research, right?
So we are not.
Whether we can involve that as a separate subject.
You want to put a tweet and say that teaching dental materials.
It's we know theoretically dental materials, ma'am.
In pharmacology, exactly, I understood. So it's not clinical dental material. In fact, you are going more backward to the manufacturing. So
yeah, it's a part of manufacturing and a research.
But it becomes too much of a research topic of the subject of dental materials, chemistry, science, development.
Right. We have read in dental materials, Phillips, we have, that is the standard book, we follow Phillips. In that, they have given only one chapter, applied dental materials, something like that. So we might involve something new into this, or I don't know, you can guide me. Or
No, yeah, what you do is, you think more deeply. You think whether you want to know how to teach it, you want to know how to design a curriculum for those who are designing a curriculum.
Designing a curriculum, a clinical dental material, separate.
तो ऐसा बोलना.
Separate subject.
हाँ, ऐसा बोलना.
And in that even we can.
Those who want to design a curriculum have to know the Kern's model. So,
right.
Yeah, 6 steps in Kern's Kern's
right,
steps.
right, ma'am.
So we will do.
I don't know whether it is too much or should I go to some other topics.
No, you think more. You are not thought very deeply. You are just thought of an idea, but you're not gone into what people have done in this. Whether there is a need to do this. You are interested. Student बोलेगा मैं तो clinic में interested है. दूसरा बोलेगा कि मेरे को तो
that's what
how much money I get is important. You are not. They are not going into a research lab working, man, to Cipla or Colgate or somewhere. Only they will be interested. Achha, can you all throw some light on this, all of you, starting from Meenakshi? I can see Meenakshi, then I can see Sandhya, Jyoti, Anand, Arun. Ek bolo fatafat.
Ma'am, actually, I feel topic seems to be good, but the exact outcome and how is she going to assess whether the knowledge has been imparted to the student?
Yeah, it's a difficult topic, but I don't know, like.
No topic is difficult because the topic is broad now. When you fill it down now, it becomes easy. All these people who talked about so many things.
What I thought was like when I read Phillips theoretically, like all the materials I'll take, and each material we read only theoretically, this is the composition, this is the composition.
I agree.
But at the end, like in that same thing, like one paragraph I can involve or something like that, as you told, from different people.
One paragraph involving is okay. But how does it help me in my clinical practice in 3rd final year as a MDist or maybe in a clinical practice? I don't care from where they have brought the zinc phosphate, cement, the ingredients. And see, ingredients are important for the manufacturer and for this ISI standards. And for the FDA, if it is in the, like in an implant type.
And most commonly what we use that like we can involve so that the kids or the students will be more oriented towards research and they might
Jyoti, can I tell you one thing? You are so full of it. You are not able to listen to the questions I am putting. I really appreciate that you like the topic so much. You like it. Will, is it necessary for the student? Will the college allow you to do that? And what are the other things? Think from all. Think of 1 or 2 literature topics, not only in this, in general, but applied part, how to introduce it, how the teaching learning method comes. Do you want to test it? We test the teaching learning method, then it is for the teachers. If you test the teaching learning method where the students have understood assessment, that becomes a student assessment. So it's you think what aspect you have to do.
Ma'am, maybe she can incorporate the need assessment of clinical touch of dental materials from undergraduates and interns, because they would have and then
interns will not. Presently, our system doesn't allow the interns to be kept in check.
Interns are out. Only the students
come and they get a certificate. Many colleges tell them there are no patients, so please go and come back. So don't talk of what is not. Let's be practical. Let us not sit in the ivory tower and talk some big thing. Think of it. And Jyoti, I think it is still not gelled at all. Baki log jaisa thoda educational ka soch, and then look into the literature. Think of other topics also. This topic, if you want to include as a one small aspect of it, then think about it and come. And you can WhatsApp me and I'll see the WhatsApp. Because for a week I am not there. Okay, who else? Arun, आपने क्या बोला?
Ma'am, need analysis to shorten preclinical exercise in the first year MDS.
Very good. Excellent.
Rohit, Dr. Rohit is there, ma'am.
Rohit?
Hello, ma'am. Good evening. Ma'am, actually, I'm traveling in the train going home. Can I call you tomorrow and tell my topic?
Okay.
Last time I discussed with you.
What did you say?
My laptop. Tomorrow I'll call you, ma'am.
What is the topic you told me?
It was regarding early clinical intervention for the BDS
Early
students.
exposure.
Yeah.
Okay, okay, fine.
So tomorrow I'll call you, ma'am, after reaching.
No, don't call me tomorrow. Tomorrow I'm too busy. I'm busy till
Okay, I will
Monday.
send a text on the WhatsApp.
Text me, WhatsApp me, WhatsApp me.
Okay, okay, ma'am.
WhatsApp me.
Okay, fine, ma'am.
So you will prepare next week, and next week Ashwini has written to me to not have 28 but on 29th Wednesday. Is it okay?
Yes, ma'am.
Yeah. So you prepare at least 8 to 10 slides.
Okay.
The topic, you give 2-3 titles. Titles also always needs to be written concisely. You need to like write it concise, but at the same time, what is the aspect of the research and what is the every aspect title need not include study design. Initially try to include study design, then remove it, because many times you put a wrong study design and you will be trapped. Okay, so think about 3-4, write 10 titles and show us 3 or 4. 1. Secondly, have an introduction, why it is essential, what is the background. Then you have on what you are going to do, what is the outcome, and what is the indicator matrix or concept map that you. Concept map is enough now. Indicator matrix बाद में करे. Concept map कर दो कि कैसा आप उसको reach करोगे वो place को. I want to go to say Bhubaneswar. How will I go? I will take a flight, but for the flight I need to book. I need to always go here by taxi to the airport. Then how will I reach? What will I do? Everything is there. So concept map has to be there.
ये तो पूरा निकल जाएगा.
I'm sharing my screen. Can I?
Yes, ma'am.
Yes, ma'am.
Do a little bit on one topic so that. Okay. What does this slide indicate?
Self-directed learning.
What?
Self-directed.
Why self-directed? ये कौन है?
एकलव्य.
अरे वाह 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 वाह, सबको आता है
He
यार.
learned by keeping the statue of.
How did he learn? हाँ. So there was a motivating factor, huh?
Yeah. He, without having guru, he just saw himself
And
statue.
what made him successful is practice.
Yes.
But still he felt that he's obligated to the guru. This 2023, ask your students. If you want them to be even 1/4 or 1/10 of Ekalavya's way, you have to come up to the level of Dronacharya, the teacher, because he was so good. He was so good, was seen in Arjun. See, I don't want to go into the mythological stories because I don't want to be sounding okay. All right. Any skill that you learned by self, can you share? Any skill. Recently, maybe 10 years back, maybe when you were a child, or maybe now. What did you learn?
Cooking, I learned.
Very nice. From where?
I made separate my own dish, ma'am.
How did you learn?
I just combined some of the things which I wanted and made.
Okay, from
One
your
specialty I made
experiential learning. Okay. What else did you learn? Everybody?
Madam, river rafting.
River rafting. How did you self-directed learning, man? They give you instructions.
Madam, no, madam. One of my friend is into that business, madam. So,
okay.
So I met one instructor just to tell me like it's not like self, madam. Some guidance he was doing, but it's not like the way we do.
Many a times you have done the self-directed because you are saying that you learned the intricacies of it yourself. Done. No problem. Anybody else?
Ma'am, parking the car in the narrow space. That I learned recently.
Okay. So for that, why do you call it self-directed?
Because
what did you do for that?
Ma'am, nobody
some
can
of
make
our
you
things
understand that
into
how
it.
to. You have to
आपने क्या
understand.
किया? I want to know the steps. What all you did?
I did trial and error, ma'am. Watch some of the animation videos. Then
So
I
first,
did this trial and error.
Second, after trial and error, did you look into something?
I
something?
looked in the mirror and I guess some of my point that how to keep little bit forward and backward. I did my guesswork, ma'am. And
Okay. So what drove you to do this? What motivated you?
Because ma'am, actually this is one thing I was not able to do, and I used to ask other people
So
to help
now
me.
is the answer. The student should know what is to be learned and how it is to be learned and from where they can get more information. I'll give you a simple example. All of us are very good at even some burrito ball, Mexican dishes and all. I all learned it from YouTube. What made me learn this is a crude example. I'll give you other good examples. In the COVID time, you could not order and get and go to restaurants, right? And we always feel that there should be other type of food also. So that also made you gather. First of all, I felt the need to learn. So I looked into the recipe. I thought YouTube is giving me step by step. And then YouTube is also teaching me the ingredients. The video is there. And also it turned out good. So more and more I started looking into YouTube for learning it. But what drove me is necessity. What drove me is where will I get the information. One more self-directed learning good example is, as the COVID started, we knew that we cannot just sit at home and do nothing or just do the home activities. We are multitasking. I can cook and I can do other things also. So digital platform, how to learn. I can ask somebody, they will tell me something. So ask and learn. YouTube, see and learn videos. Maybe try and learn, trial and error, as Mirna said. Multiple things I did, but I was ready to learn. The readiness to learn is the most important thing of all the things in self-directed learning is not ये topic मैंने लूंगी आप ले लो आप पढ़ लो खुद ही. That is not self-directed learning. You're directing yourself to the need to be ready to learn, to gather the information, what to learn, to also master it if needed, and ask questions if needed. Today, let me tell you, So I'll give you the reasons first and then I'll talk the next topic. The reasons that made you learn is independent learning skills we develop. It makes you feel good and it makes you feel more responsible too. Because I felt that I am able to drive. I initially learned the driving. I cannot drive, I'm just telling you, but with a teacher, instructor. But unless I put my hand on it, I think about the signals, I think about the traffic rules. So certain amount of self-directed learning comes over here also. And it facilitates self-governance, decision making. That's the importance of self-directed learning. Decision making. It increases accountability. It's an aid for lifelong learning. All teachers have to learn lifelong. It increases engagement to the learner. If you tell the learner that aaj flip classroom next time, you are the teacher, you are going to show me, and I am the student, I will see and I'll flip the class, but I will also help you if needed. The students will be engaged. What is engagement? Engagement is to be focused. Engagement is to be with me when I am talking, to be with you when you are talking, not interrupting, but complete focus on you is the best conversation I can have. But self-directed learning, we should always be ready to learn self. We should feel responsible for it. There should be good amount of ways I can learn, like from my peer, from my friend, I can ask and learn, facilitate self-decision making. It facilitates. So I become a better decision maker. I also now know that I can learn a lot of things online, or I can learn a lot of things on my own through the literature. I have literature, I have videos, I have some websites, I have some apps. So self-directed learning makes me empowered. It increases my focus, my attention, my engagement. It's a process in which individuals take the initiative with or without the help of others. But I will always say with the help of others. So they diagnose the needs. Mirna diagnosed her need that I have to park in a narrow space. So I need to learn. So she had the goal. She formulated the goal. So how do I do that? By observing, by seeing some video, making a mistake, trial and error, asking. And she implemented it. So learning strategy was thoda thoda karke, little, maybe mistake this time. I even banged it, but I still learned it. And now the evaluation is done of the outcome is that you are able to park properly. Malcolm Knowles, I will mention again and again because he is a great educational psychologist that we had. Are you all with me?
Yes,
ma'am.
So self-directed learning and self-regulated learning. What is the difference? You have to be regulated, self-directed learning, but it has to be regular. It has to be regulated. What all steps to be taken for that? How do I gather the material? I cannot just presume and assume and learn something wrong. If I want to learn the music, I should know the notation. 12 स्वर मालूम होना मांगता है. 12 स्वर, उसमें मुझे मालूम होना मांगता है कि सप्तक क्या होता है, तार सप्तक क्या होता है, मंद्र सप्तक क्या होता है. How I can sing in different notations. There are more differences between self-directed learning and self-directed learning and no similarities. This is a topic of debate for all of you. Are you for self-directed learning or self-regulated learning?
Self-regulated.
Okay. So actually, it is 7:30. Otherwise, next time I want you to present this slide. Group A is for and Group B is self-regulated, self-directed and self-regulated. Let me show you the slide further. Because the breakout room मैं नहीं कर रही हूँ. SDL is basically establishing learning goals, identify, locate, access and resources. From where can I get the material for my music? Where can I learn the theory part? I should know the Aro. I should know the Pakkad. I should know Varjit Swar. All these things I should know. And then I will know the Rag. Rag Bhoop bolega to mujhe pata hai that it is of some family. I'm not going into detail, but there are two swars Varjit in that or not in that. So I can identify that. I have to identify how you look or how I look. You identify. Oh, madam is not very tall or madam is tall. Madam has short hair. I have to identify. So I have to identify from where will I get the resource and how will I get the resources. Is there a readiness to learn? In the team-based learning, the readiness scale is the most. Are you ready to work in the team? You know, that is very important. We'll come to that. You have to reassess and reflect on the learning strategies, learning methods and strategies. What is the activities I need to be engaged in? How will I assess myself? So first, I'm ready to learn. What is my goal? Why I became ready? Because I wanted to learn music. And I wanted to know who will teach me. But there is a lack of me able to go to places. So can I gather some information, learn online and learn physical both? Can I engage in practice? Can I engage in the learning? And how will I reflect on how these every swar is identified, how the sa is different from the tar saptak sa. Sa is different from tar. When I say sa in a lower form and sa in a higher form, I'm telling you for music, because that is one way easily how I can teach you theory and practice and singing and implementation and evaluate. Ultimately, evaluation can be done by the college, by the teacher, and you can evaluate yourself. So how do you facilitate self-directed learning in your colleges? How it's important. You cannot say that go and learn this from the book and come. No. You have to create an atmosphere for that, an environment that this is the way it is. I mean, we should know about the dental material. She said that they should know even from where these ingredients are sought from where they are got from, what are the actual ingredients, she said. So now I cannot tell them. I have to give them some resources. I can tell them that can you think in a group and work, and can you see the literature, can you read this book, and would you like to do it? I have to give them some direction. So to assess the readiness is the first step. To set the learning objective goal, to engage in a learning process, to evaluate, students should know how they should go about with the self-directed learning. So the student should be made ready. The readiness will come not by asking them, I am going to keep a test. No. Why the self-directed learning is important? It gives you a self-decision making. It makes you fulfilled, happy. So you give them a goal and tell them that this is what we next class, we need to discuss this. And only when you know this, only when you know the bone physiology, will you be learning to respect the bone physiology when placing the implant, or you understand regarding the bone implant surface. You have so many things to tell them to make them understand, and what resources they will get, how to engage them, whether they will learn self-directed or the self-directed they will do in a group, and how will you evaluate them that are learned or not? How will you give them the timely feedback? So Gerard Groh has defined following stages. The learner is dependent when he comes to the college. He's come to a professional college from the school, high school, or maybe the 11th and 12th college. It's not a professional college. He's come, so he's dependent. So give them that. Just now Padiyar said support is needed. Give the support. Give the teaching support and the support for them to feel safe environment. Make them interested with some, proper cases, maybe some early clinical exposure, maybe some sort of a story. Then get them involved. And then you tell them these topics need to be done. So this is very, very important. Teacher is a facilitator. He has to match the learner with the stage and prepare for higher stages. He cannot tell a first year student that you learn this material and come. He's dependent learner. You teach them some, maybe the hygroscopic expansion, but you make him interested why this hygroscopic expansion occurs. Or maybe he gets involved in it and you say you find out, and with experimentation and find out more, its applications in practical. So self-directed learning is to be applied in steps. The dependent students, the teacher could be a coach. You are teaching them the right thing, so you have the authority with you. We can be a motivator or a guide for creating the interest to the stage 2 learners. They become interested. And then you become a facilitator from the coach telling them every step. You become a facilitator. And when he's ready, you become you delegate him what to learn. You only give the consultation when they ask. You first tell him what is the work to be done. So teacher style is a very important slide. Can you all click a picture of this? Okay. See, teaching learners to be self-directed is a very important article. I'll try and send you this article, systematic review done. The effectiveness of self-directed learning. What all the added advantages? See, एक advantage नहीं होता है किसी भी चीज में. Disadvantage भी एक नहीं होता है. There are multiple advantages and multiple disadvantages. And of course, the advantages to overweigh to the disadvantage. So you can have the dependent learner can be given a lecture, didactic, face-to-face lecture. We can have discussion groups after the students come to the second term of the first year or second year students. We can have structured discussion. Group A will do self-regulated directed. Group B will do self-directed. I show you the structured discussion here. And here I will have the student and I will direct him, but he will discuss it and he will discuss in a group and he will do it independently. The path may not be the same and at same pace for all, because I cannot put all the students. Abhi aap second term mein aa gaye, directed. You are now only interested, you are not a dependent student. You're interested student. Aisa nahi hai. There are some people whom between us we can call them as they need little more time to learn, slow learners as we call, but I'll say they require little more time. Maybe their language is not so great, that English is just a language. So pace of how the students learn is a very individual thing. All these things come in a learning environment. Learning environment should be such that the pace a student should match with his learning. He will feel very, very upset if you are going very fast and not caring for him. You have to identify. How do you identify? In a mentorship, we say group mentoring is the best. When you have a student, I'm giving you 10 students to mentor, and one student is talking, discussing very good, or maybe not so good because he's not allowing others to talk. One student is not talking at all. One student is looking down. One student is showing some expressions, but he's not able to talk because the over talkative. But over talkative fellow cannot be insulted. You can say, I want all of you to speak for a second or maybe a half a minute. So I can say that now who will volunteer next? If somebody is not talking, I can say, Ramesh, can you talk? Can you come out? I will help you. Or can you, I just want to know your viewpoint. Thank you, Ramesh, for that. I mean, these are the things. See, these are the things when before we go into the class should be discussed with us. So there is learning readiness scale, which is there throughout any other learning. No, team-based learning is all about readiness. It all come IRAT and this rat and that rat. Last year, one student did on team-based learning from Saudi Arabia. So his topic and his this thing also came. Why did he require to do team-based? Because the students there are unable to speak in English much. They learn in a group better, and they also encourage each other. They learn from each other. Team learning is very good. We'll talk about team-based learning. Self-rating is also important. Self-rating of self-directed learning is very important. So how much, if I say, I sing better than even A.R. Rahman, I'm overrating, not only overrating, I'm destroying myself. I know everything. I am not able to improve. I should be able to actually say that I have learned, but I need to do more in this area. Maybe I have not understood the application of certain clinical procedures in a complete denture or a theory part or whatever. So what is the instrument you will use for? Instrument is the way you test. Instrument is not a physical instrument. It is the way you test them with on a scale, maybe 1 to 5. Your visual analysis scale can be used. You can use Likert scale. You can use any scale, or maybe you are interviewing, great qualitative test. So it all depends upon what you want to do. So let me tell you, self-directed learning readiness scale, also known as learning preference assessment to avoid response bias. Because when I say response bias means what? You tick if it is true or false, it's okay, either black or white. But when I say 1 to 5, I know about the properties of a low fusing compound. I will say yes, there will be bias in that. And I really don't know what makes it low fusing. I don't know that what the temperature of its by which it will burn. So I should know. So I'm looking forward to learning as long as I'm living. The student should be encouraged that you will keep on learning more and more. I know what I want to learn. When I see something that I don't understand, I stay away from it. So the students can mark these on a scale of 1 to 5. If there is something, he becomes ready. If there is something I want to learn, I can figure out a way to learn it. I want to learn maybe to make something, or I want to learn about diving. So how does divers go down and how the divers come up? If you're interested, you will learn. We all went for a family outing, and in the Cairns, up of Australia, north of Australia, we got a lesson on diving. I was not interested, so I never paid any attention. I never went inside the water. Those who were interested, my children, not only did the basic course, they did the advanced course. They do the course as though they are interested. They were ready to learn. I was not ready to learn because I was not interested in diving, or maybe I'm afraid of. Ask a question, I say, yes, I'm afraid. But when the pictures are shown to me, I said, yes, now I also want to learn. Such colorful bays in the sea, I also want to. The Great Barrier Reef is seen from the space, they say. So I have gone there, but not done the diving. But then one mind tells me, I am not ready. Till I am ready, I'm not going to learn. That's all I want to say. In a classroom situation, I expect the instructor to tell all class members exactly what to do. He's a dependent learner, that means. So how will you make him independent? By telling him that partly it will be told and you should think, and in between the lines you should understand. Or maybe you give him some exercises. It takes me a while to start on new projects. Maybe it takes some time for me. I believe that thinking about who you are, where you are going should be a major part of every person's education. What do I want to learn? Why am I here? How will I learn? How will I become better? Practice makes a man perfect, and we all fault in that, all of us, because we don't do the same thing again and again. How do you think all these ustads or such a great maestro in every instrumentation that they do, tabla or anything, it may be a sitar, it may be anything, flute, they have practiced 10, 12 hours from the childhood. So I just do a root canal and I say, I know how to make a root canal. That is theory. Partly practical because I just touched one. I don't work very well on my own. So he's still not. So the scale is there. I will send the scale and give you the question, but I don't want the answers, responses now only, because I'll send it to you. Almost never true of me. I have hardly ever feel this way. That is scale 1. So 1 to 5, I have given whatever that novels has given. I have given you that. Changes in self-directed learning readiness in dental students, a mixed method study. This is done, in Dental Journal of Dental Education, 2014 is published. I'll try and send this article to you. So potential strategies are student seminars, presentations. They prepare for it and come. They become ready. I look at a student and feel, arey, he got an opportunity to present. I will also present. You can have open panel discussions, flipping the classroom. You can have talks. You can have star talks. IPS is doing. You can have any talks. You can name them anything. And brainstorming sessions. Open book exams. We'll discuss about open books exams later. Open book exam is also not easy. Because if you are not read, you don't know which chapter this comes or which line it comes. Reflective practice, reflecting on today's session, what we discussed regarding project. I prepared your mind to think from all aspects, that you cannot have a broad topic, you have to funnel it down. जब funnel में से निकलता है any oil, it comes as a small stream. And if I want to make it more focused, I'll make the funnel very narrow. I'll not make a broad funnel. So journaling is writing your experience or writing a story or whatever it can be. Problem-based learning classes, project-based learning, inquiry-based learning, team-based learning. These are all different ways of other than regular learning. And it also helps for self-directed learning. Out of all this, I want you, can you click this picture and take it? I want you to know what is team-based learning. We'll discuss it. Inquiry-based, project-based learning you're doing. You are all making a project, no? Journaling will help you a lot. They say in life, if I do the journaling, it's a psychiatric counseling for me. What makes me feel very bad as a child? Some people carry the childhood to the adulthood. All of us have seen that. So they say, no, my mother did this to me, my father did. If they write it down, no, what has happened? It will be completely gone. So journaling, writing down, it comes from the subconscious mind. Assessment of self-directed learning is a big challenge because assess for development of skills to engage in SDL skills. You're taught them, they reflect on it, and mostly these skills are affective domain. Because when you say that what are the skills required, I need to be ready. I cannot measure exact readiness and exact forthcomingness, because that is also affective domain. This is a qualitative study again. Assess for the results, consequences of self-directed learning. This is also one topic. So see, what I'm telling you is it's a challenge, because whenever affective domain comes, it has to be only on the instrument scale. And when I give the instrument, there may be response bias, I don't know. Any assessment method targeting the goals outlined for SDL. A debate is good enough. Assessment via MCQs is good enough. Assessment by MEQs is good enough. Maybe flipped classroom is good enough. So you have to have self-reported measures. They have to self-assess and give what makes them learn better. Again, a topic for academic environment. What makes them learn? What makes them learn is just not paying attention, but making them feel interested, engaged, and also worth. All of us are seeking self-worth all the time. Students also need to be acknowledged for self-worth. The subjective approaches, including reflection, interviews, observation of behavior. So integrate self-directed learning in the curriculum in your teaching methodology. That's all I want to say for today. That plan how to integrate SDL in your topic. That's your assignment for next time. Give the topic to the learner, which the learner group, first year, second year, new learner, dependent learner, strategies that you plan, how they can learn, gather the resources, are they ready, how to plan, whether the objectives can be achieved, what you want them to learn. You can have a flipped classroom. Last time we did that with you, but it was not actually flipped because the topic was not easy. So Dr. Dange kept on talking. You prepared for debate via reading materials, or you collaborated with the team members, because students will collaborate for preparing. There will be discussions, and the class time was used for discussions. So they learned a topic and they learned the skill of self-directed learning and flipped classroom. They learned to work in team. They learned to adjust with each other. They had to do self-study. They had to have self-regulation, because they have to allow other people to talk. Use some good words like, can I come in? Can I come in? Can I speak? Something like that. The reinforcement, and also reinforcement of self-worth, and also the time saving it becomes when you're teaching multiple skills to them, including affective domain. So experiential learning and co-curriculum. Let me tell you, when learner is doing something, experiencing and then learning, examining a patient, you have already learned. But co-curricular activities, when learning for any topic of interest beyond curriculum, making a rangoli is not making only a rangoli. It is showing focus, concentration, color combination, and allowing to be within that design what they have done. Lot of skills you're teaching them, and they're learning it by self-directed. So learning by doing is experiential, because you were taught how to do the border molding and you learned it and you did it. But the experience showed that you burned the patient. That also you learned. So multiple things are done. So learning by doing is actual, involves that you are getting bolder, you are getting some confidence. So here I want to tell you about COPE cycle, very important cycle. You have experience of something, you have experience, concrete experience, but for that, you initially had an active experimentation on something. You wanted to test. Why did you test? because you had an idea. Now, you developed an idea for your project and now you want to test the idea. You will have an experience with that. You will reflect whether I can go back and make the implant module better or was it good? Even in the making stage, the planning stage, you will think that what performance testing can I do? How will I do? So you are reflecting first. It's a cycle. Then Mirna will think about the idea, but because she'll reflect, she will search the literature, she'll make the idea. So this is a COPE cycle. This all the time we are using. Please remember this cycle for yourself. So teaching evidence-based dentistry or teaching to dental students, self-directed learning will help a lot. Nobody last year also took anything about evidence-based dentistry. People are all talking about is evidence good enough and all, but more of it was applied in pharmacology, but it is important to certain extent in certain things. Okay, so I think I will close down this, stop sharing. Were you all paying attention to me?
Yeah, ma'am. Thank you, ma'am.
No.
Yep.
Can you put all your videos before we close? It's 8 o'clock. Switch on the video. Jyoti, Arun, Siddharth.
Madam, yes, madam. We were listening to you, madam.
Yeah, I know. I think Rohit is the only one who was traveling or something. It's okay. So did you get a broad idea about self-directed learning?
Yes, ma'am.
You have to have ready to learn. You have to be ready to learn. You should have the resources to learn. You should be able to be tested. Self-testing is also important. It's a very important thing for your project. That's why I took it today. So will you be ready for next 29th?
Yeah, madam.
It will be the first. They say, why do we all don't publish? Because we have a writer's block. What do they say? Writer's block. We are block in the mind. मैं कैसा pen down करूँ? मेरा language बरोबर आएगा क्या? People will appreciate it, or will somebody say I plagiarized? What will happen? Block. To remove the block, they say, first draft it, just draft it widely. कुछ भी लिखो. The first draft gives you confidence. The first draft is a down draft. Down, kachra mein. Second draft gives you a little more of what you want to do, like funneling. Your introduction is nothing but funneling. It is broad idea, what is to be you are wanting to test, and exactly what is to be, what is known, what is to be known, and what you want to do. That is introduction in 3 paragraphs. And the third writing draft is the one draft which requires now to be modified, remodified. So don't have a block for writing your project or thinking about the project. So I think I'll let you go. You had a long day because I continuously kept you about newer things and your also ideas, etc. So you deserve a very good dinner. So I'll let you go. Yeah. Yes. Somebody said something. Meenakshi is laughing. What happened?
Ma'am, yet to prepare dinner, ma'am. I have to go now and prepare the dinner.
Yes, ma'am.
We're all experts, half an hour mein ho jayega.
No, ma'am.
You have to think of dinner from pre-plan so that things are ready. And on Tuesday or Wednesday, whichever class is there, you should make easy dinner. Yeah?
Yes,
Thank you, ma'am.
Welcome. Most welcome.
Thank you, ma'am.
Thank you, ma'am.
Bye. Thank you.
Bye.